And good morning. This morning we'll be talking about the cervical and brachial plexus. So the first part about the cervical plexus to remember is that when we're talking about the cervical nerves, the first cervical nerve is actually coming anterior from C1. So the atlas or the cervical atlas. The first cervical nerve is going to come from C1. After that, everything is going to come out from the inferior portion. So between C1 and C2 here, what we're going to see is C2 nerve exiting inferior to C1. We're going to see C3 nerve exiting inferior to C2. We're going to see C4 exiting inferior to cervical vertebrae C3. So what we tend to see is we have 7 vertebrae, but then we have 8 spinal nerves. And that's how we get the difference between the vertebral column and the cervical nerves of 8. So the first one that we're going to just talk about is the cervical plexus. It involves C1 through C4. C5 is not included in it, but it is also a distributor of the phrenic nerve. But for the most part, they consider the cervical plexus C1 through C4. When we're looking at what it innervates, the innervation is going to be the anterior neck muscles, skin of the neck, portions of the head, and the shoulder. The phrenic nerve is going to become important. We'll talk about this later on in the respiratory chapter, but the phrenic nerve is going to become important when we're talking about the diaphragmatic function. So the phrenic nerve is involved, innervates both the sensory and the motor nerve for the diaphragm. The other two that should be mentioned are the cranial nerves of the hypoglossal nerve. The hypoglossal nerve is considered an accessory of the cervical plexus because the geniohyoid and the thyrohyoid nerves are going to lie within the sheath of the hypoglossal nerve. And the accessory nerve is actually, as you can see here, if we go over, is being contributed by C2. So when we're looking at the accessory nerve here, its contributions, or there are branches of C2, C3, and portions of C4. So we must include those with our discussion about the cervical plexus. The other term that sometimes gets a little bit confusing is this term here called ansa cervicalis. The ansa cervicalis is kind of a loop system. When we're looking at the loop system, we can see that it primarily comes from C2, but we can see how the ansa cervicalis is going to form a loop, but it's also getting contributions from C1, and we're also seeing contributions to this loop from C3. This loop system has 4 branches. These are going to activate the motor function or the motor nerves. You'll see one branch is here, one branch is here, we have another branch here off of the ansa cervicalis, and another one here. The ones that are most often associated as far as the motor nerves on this are going to be, and we'll discuss this further on, the inferior omohyoid. I'll just write the abbreviations here. The sternothyroid, which is this branch. So we see the sternothyroid coming off here. And then we see the sternohyoid. So sternohyoid is this branch right here. And then finally the superior omohyoid, which is right here. These four are what are classified as the ansus cervicalis. So when we're looking at this, we just want to be aware that there's also cutaneous branches. When we're looking at the cutaneous branches, the first one that we're going to look at is the greater auricle. When we're looking at the greater auricle, this is going to supply the cutaneous or the sensory information for the skin on the ears, connective tissues, covering the parotid glands. When we're looking at the lesser occipital, this is going to give us, or is a cutaneous branch, gives us sensory information about the skin of the scalp, superior and posterior to the ear. The supraclavicular is a cutaneous branch, mostly out of C3 and C4. It gives us the sensory information from the skin on the superior part of the chest and the shoulders. And the transverse cervical originates from, or the cutaneous branches come from C2 to C3, and it gives us sensory information on the skin on the anterior part of the neck. As I mentioned before, the geniohyoid and the thyrohyoid muscle branches, or motor or muscular branches that are coming off, are predominantly from C1. This is also going to be, these two branches are lying within the sheath of the hypoglossal cranial nerve. Its job, the geniohyoid, the first one here, its job is to innervate the tongue. It also elevates the hyoid bone. The thyrohyoid elevates the thyroid and depresses the hyoid bone. And again, they're going to originate from C1, and they lie within the hypoglossal cranial nerve sheath. The omohyoid, see these again are going to be portions of or branches of the ansa cervicalis. The function of the omohyoid, it stabilizes and depresses the hyoid bone. When we're looking at the sternothyroid, this is going to depress the thyroid cartilage. The sternohyoid is going to depress the hyoid bone. And these are all going to be contributed from branches of C1, C2, and C3 spinal nerves. And then we have the phrenic nerve, which is important because it branches from C3 and C4, which is the main contributor. C5 is also involved. When we look at the cervical plexus, we really look at C1 through C4, but we are getting contributions of C5. The phrenic nerve does both the sensory and the motor intervention into the diaphragm. And as mentioned before, the accessory nerve, its job is to innervate the sternocleidomastoid and the upper portions of the trapezius. It is getting contributions from spinal nerves C2, 3, and 4. The hypoglossal nerve, which again mentioned this earlier, the geniohyoid and the thyrohyoid muscle or nerves run within the hypoglossal nerve sheath. The job of the hypoglossal nerve, or its function, is to aid in speech, food manipulation, and swallowing. So moving into the brachial plexus, just some contributing facts with the brachial plexus. The brachial plexus is going to be the intervention of C5 through T1 spinal nerves. It extends laterally from the neck. So we can see here how we have the first extension of the spinal nerves, or the anterior rami, or the roots, coming laterally from the neck. It passes, if this is rib 1 here, it passes superior to rib 1. So here's rib 1 right here. It passes superior to rib 1 and continues into the axilla, or axilla. So we see that it's going to travel deep within or under behind the clavicle, and eventually it's going to be running along the axilla or the side of the body. These nerves are going to innervate the upper pectoral girdle. So we're going to see the upper pectoral girdle. We're also going to see the upper portions and lower portions of the limb. So these three areas. When we're looking at the cervical plexus, it is going to, or brachial plexus, excuse me, it's going to involve C5 through T1. And again, we can see that this is actually vertebrae 7, and we see it's called spinal nerve C8. And we talked about that earlier, about how C1, the first spinal nerve, is going to leave anteriorly, or excuse me, superiorly, and then C2 spinal nerve, and we just continue that progress all the way down. So that gives us 8 spinal nerves with 7 vertebrae. Some of the terminology that we should be familiar with is first the anterior rami. They also call these the roots. They are going to originate from the intervertebral foramen located on the sides of between the body and the transverse processes. From there we go into what is called a trunk. So these are going to be the trunk. They're divided by the superior, middle, and inferior trunks. And each one of these is going to have contributions from the anterior rami or the roots. So we can see that the superior trunk gets its contributions from C5 and C6 anterior rami or roots. We see that the middle trunk is primarily getting its information from the C7 spinal nerve or anterior rami or root. And we see that the inferior trunk is getting its information from the C8 and T1 anterior rami or roots. Portions of these trunks, they are going, this is usually around the clavicle is where we see the branching of the trunks in the human body. So we're moving laterally from the neck, and about this level is where we're going to see the clavicle. So at this level, we see here's the first rib here, and it's going to wrap around, and then we're going to see that these trunks are going to be dividing deep to the clavicle. The next part is going to be the divisions. So when we're looking at the divisions, we're going to see that we have 2 major divisions. We have an anterior division, which is located in green. And then we're also going to have a posterior division, which is color-coded in purple. After that, then we form the cords. They're located in blue. So we have the first one, which is the lateral cord. The second one, which is the posterior cord. And the third one, which is going to be the medial cord. The cords, the lateral, posterior, and medial cord are all being named in its relationship to the axillary artery. So when we get to this region of the brachial plexus, all cords are named according to their relative position to the axillary artery. So when we're looking at these different cords, we're just going to break this down and go a little bit backwards. So the first one we're going to look at is the superior cord, or the posterior cord. So the first one we're going to look at is the posterior cord. It's part of, when we look at the division, it's going to be part of the posterior division, And we can see as we draw the lines here, it's going to be contributed, if we keep following up, it's going to be the contributions of the posterior cord are going to come from C5, C6, C7, C8, and also portions of T1. So the posterior cord is going to have from C5 to T1 spinal nerve contributions to the posterior cord. When we look at the medial cord, again, the cord is named in relationship to medially to the axillary artery. So when we draw a line up, we'll notice that we see this is part of the anterior division, and we continue to go through. This is also part of the inferior trunk, and its contributions come from C8 spinal nerve and T1 spinal nerve. And the last one is the lateral cord. This is named according lateral to the axillary artery. We're going to come up and pick up the anterior divisions. We're also going to see with the anterior divisions, we're going to pick up the superior trunk, which means that we're going to pick up spinal nerve C5, spinal nerve C6. Also, what we see contributing is going to be drawing up from the lateral cord. We see that we're still in the anterior division, and we pick up the middle trunk, which also involves C7. So the contributions to the lateral cord are going to be the superior and middle trunk and the anterior rami or the roots of C5, 6, and C7. When we look at the terminal branches, we're going to look at the muscles that these innervate and a little bit of the portion of the cutaneous or the sensory information that is coming back to these portions of the spinal cord. The first one we're going to look at is the axillary nerve. The most important aspect is that it's formed from the posterior cord. And then we also see that it's going to follow or go through transverse to the axilla, posterior to the neck of the humerus, and then the nerve is going to innervate the deltoid, and it's going to innervate the teres minor. These are important. The deltoid abducts the arm, teres minor laterally rotates the arm or externally rotates. And we're also going to see that it receives sensory information from the superior lateral part of the arm, so the upper portion of the deltoid. The next one is the median nerve. It is again formed first from the medial and the lateral cords, so it gets its contributions from both. So we can see here the medial cord coming down and innervating into the median nerve, the lateral cord contributing also into the median nerve. It's part of the anterior division, which means that it's going to serve the anterior portion of the human body. So we're going to be looking, this is a right arm, so we're looking at its contributions to all of the anterior portion of the forearm. So we see the flexor carpi radialis flexes the wrist, the flexor digitorum superficialis, which flexes the digits of the fingers, the lesser forefingers, the pronator teres, which is the distal or the proximal aspect of forming into pronation of the forearm. The pronator quadratus here. These two actually work together to help pronate the forearm. The flexor digitorum profundus, just the lateral half. And what that means is just the outer portion of the flexor digitorum profundus, just the lateral one half. So we're looking at the index finger. And the flexor pollicus longus. Anytime you see the word pollicus, it's referring to the thumb. So this median nerve is actually going to activate flexing the thumb. Also, what we see in the thumb muscles is the thenar, which is the very strong muscular pad located just distally from your thumb on the palm side, usually located about right here. This is your thenar. We see the muscles associated with the thenar thumb muscles are flexor pollicus brevis, abductor pollicus brevis, and opens pollicus. Again, when we look at sensory information, our cutaneous intervention from the skin, what we're going to see is the sensory information is going to come from the 3 1/2 digits. So you can see portions of the tip of the thumb, the first finger, second, and just the tip of the third. And then it also gives us the palmar aspects of the thumb, first, second, and portions of the third finger. The musculocutaneous, it originates from the lateral cord. It's part of the anterior division, so again, it's going to innervate the muscles on the anterior aspect. So here we can see the lateral cord coming down, innervating into the musculocutaneous nerve. It's going to supply or innervate the muscles of the bicep brachii, brachioradialis, and coracobrachialis. These are all involved with flexion of the shoulder, such as the coracobrachialis, the brachialis, the true flexor of the forearm, and the bicep brachialis, which does supination and flexion of the elbow. We can see the cutaneous branches, the sensory information. It's going to be the lateral region of the forearm, so the outer portion of the forearm. It'll give us a relationship of the cutaneous sensory information coming back to the body or the brain. The radial nerve, this is again formed from the posterior cord in the posterior division. So when we're looking at the posterior division, we're going to be looking at the back of the body. So we see here the posterior cord goes underneath the teres minor, comes down. It's going to innervate the tricep brachii, which is important for extension. The anconeus, which is also helps extend the elbow. It's one of the deep extensors of the elbow. And then all of the posterior aspect of the forearm. So we can see here we have the supinator, all the extensors, extensor carpi ulnaris, which is the ulnar side, the extensor digitorum here. So these are the ones that extend the digits of the fingers. And again, anytime you see the word pollicus, it's going to refer to the thumb. So this is the abductor of the thumb, abductor pollicus longus. We see the pollicus here, the extensor pollicus longus and brevis. These are going to extend the thumb. And it's a deep intrinsic muscle called the extensor indicus. Also the brachioradialis, which is right here, is important. So when we look at the cutaneous branches, we're going to see that it's all in the posterior aspect of the arm and the forearm. And it also goes down almost to the tip of the fingers of the thumb, first, second, and fourth. So this is 1. Always count the thumb as 1, 2, 3, and 4. So the tip of the fingers were more for the median nerve as far as cutaneous intervention. And finally, we have the ulnar nerve. With the ulnar nerve, it's formed from the medial cord and the anterior division. So here. So the ulnar nerve is coming from the medial cord. It's going to supply the front of the forearm. It does a lot of the intrinsic hand muscles. So it's just going to travel down. And we're going to see first that it hits the flexor carpi ulnaris. So ulnar would be on the pinky side of the body, and the radial would be on the thumb side. If we continue down, its most important functions are going to be with the intrinsic hand musculature. So the hypothenar is again the muscular pad on the pinky side, or the fifth finger. And then we have the palmar, which adducts the fingers here. So these are going to adduct your fingers. And then we have the adductor pollicus, which is going to adduct the thumb. And then we have your two medial two lumbricals, which flexes the metacarpal phalangeal joint and extends the proximal and intermediate phalangeal joints. And finally, the cutaneous intervention, we see that it's on the dorsal. So we see the back side here. Medial one half of the digits, your little finger, and the medial aspect of your ring finger. And then we also see the palmar side, same thing, the pinky finger, or little finger, and the medial aspect of the ring finger. So that concludes the lecture. Thank you for participating, and we'll talk shortly.